Hello, my name is Tabitha. I am a registered nurse who has worked in healthcare for over 28 years, and I'm currently enrolled in the RN to BSN program through ECPI University. I am here today to discuss the importance of compliance with high blood pressure medications as part of my community health lab for nursing 444L. So what are our learning objectives? By the end of this presentation, you should be able to identify the importance of high blood pressure medication, what the adverse effects of different medications can be, and different methods for obtaining the medications if you do not have access to a local pharmacy or the funds to pay for your medications. So what is high blood pressure? So your heart is the muscle that pushes blood through the vessels in your body, which include veins, capillaries, and arteries. Blood pressure is the force of the blood flowing through your blood vessels. High blood pressure, which is known as hypertension, is when the blood pressure is too high. There are two forces associated with blood pressure. Systolic, when the heart pumps out of the heart, when the blood pumps out of the heart into the arteries, and diastolic, when the heart is at rest between beats. Together, these two forces are known as your blood pressure and are represented by numbers. Here on this graph, you can see the 5 ranges of blood pressure as recognized by the American Heart Association. When you have your blood pressure checked at your doctor's office, it is measured by millimeters of mercury. The first number is the systolic, and the second one is the diastolic. A blood pressure is considered normal if it is less than 120/80, which is what's shown in that green line. Your blood pressure is considered elevated when your numbers consistently range from 120 to 129 systolic and less than 80 diastolic, which is the yellow line. Now we want to look at this orange line. This line is considered hypertension stage 1 because your blood pressure readings consistently range from 130 to 139 systolic or 80 to 89 diastolic. And this is when your physician may prescribe lifestyle changes that could include medication. The burnt orange line is hypertension stage 2, and at this point, your blood pressure is consistently at 140/90 or higher, which is when your physician may order you a combination of medications along with lifestyle changes. And finally, we have this dreaded red line, which is what is known as hypertensive crisis. If you check your blood pressure and it is 180/120, you need to rest, wait about 5 minutes, then retest your blood pressure. If it is still in this range, you need to contact your physician immediately as you may be in hypertensive crisis. Anything higher than 180/120 is dangerous, and that's when you really should look at calling 911. So why is medication important for high blood pressure? Well, according to the CDC, the benefits of blood pressure medications are clear in that they can help reduce your risk of heart disease, heart attack, or stroke by keeping your blood pressure at healthy levels. So let's discuss the risks of not taking your medication to lower your blood pressure versus the benefits of taking your medication. So some of the risks of not treating your blood pressure can include stroke. High blood pressure can cause blood vessels in the brain to burst or clog more easily. Vision loss. Hypertension, again, is what high blood pressure is known as, can cause damage to the vessels in your eyes. Heart failure. This is when the heart is enlarged and it fails to supply blood to the body. Heart attack. Your blood pressure can damage arteries and cause them to narrow and stiffen. Kidney disease or failure. High blood pressure can damage the arteries in the kidneys and interfere with their ability to filter blood effectively. And then, of course, sexual dysfunction. I know people don't realize it, but sexual dysfunction can be erectile dysfunction in men or lowered libido in women, all because of an elevated blood pressure. So what are your benefits to taking medication? Well, medication is an important part of your treatment plan if your blood pressure is high. So the things you need to know about high blood pressure medication include the first thing, well, of course, is you need to know it is different medications work in unique ways to help lower your blood pressure, and it is not uncommon to be prescribed more than one medication. Second, the medication only works if you take it as prescribed. Do not cut your pills in half or take your medicine every other day to make the medication last longer. This will decrease the dose that you were prescribed, so then it won't work effectively. Third, medication should not be stopped without your physician's approval. Do not stop it just because you feel better. That means the medication and the lifestyle changes you have made are working. If you want to stop taking your medication, you really need to talk to your physician first. And finally, even after your blood pressure is lowered, treatment will usually continue for the lifetime to keep your blood pressure normal. Understanding that managing your blood pressure is a lifelong commitment makes the change in your lifestyle an easier adjustment. So listen to your physician and make the decision to live that heart-healthy life. So what are some common types of blood pressure medications? Well, there are many classes of blood pressure medications, and some of the most common ones are known as diuretics, ACE inhibitors, beta blockers, and ARBs. But you may also be prescribed a calcium channel blocker, alpha blocker, vasodilator, or combined alpha and beta blockers. I'm going to list some of the most common medications that you may have heard of in some of the different classes. I'm going to say the generic name first, which is what you would typically see on your prescription label, followed by the brand name. Some of them have more than one brand name, so I'm only going to list the commonly known. So common diuretics can include chlorthalidone, which is known as Hygrotin, hydrochlorothiazide, which is Esidrix, metolazone, which is known as Zeroxylin, spironolactone, aldactone. Everybody knows what furosemide or Lasix is. Bumetanide, which is Bumex, or tercimide, Demendex. So some common ACE inhibitors include benzapril, also known as Lotensin, captopril, which is known as Captopin, capotin, enalapril, which is Vasotec, lisinopril, which can be known as Prinavil or Zestril, and ramipril, which is Altace. That just names a few of them because there are a lot of ACE inhibitors. Beta blockers can include atenolol, also known as Tinerman, carvedilol, known as Coreg, labetalol, which is Trandate, metoprolol with tartrate, which is Lopressor, metoprolol succinate, which is Toprol XL, propanolol IR, which is Inderal, and propanolol LA, which is Inderal LA. The most common ARBs are losartan, which is Cozar, olmesartan, which is Benicar, telmisartan, which is Micardis, and valsartan, which is Diovan. And then finally, we have the calcium channel blockers. You may have heard of amlodipine, which is Norvasc, diltiazem, which is Cardizem or Tiazac, and verapamil, which is Isopten SR, So how do the medications work? Well, your diuretics can help control your blood pressure by removing the excess water and sodium, also known as salt, that are often used, and they are often used in combination of other prescription therapies. ACE inhibitors help the body produce less angiotensin, which is a chemical that causes the arteries to become narrow. By reducing this chemical, the blood vessels relax and open, which lowers your blood pressure. ARBs work by blocking the effects of the chemical angiotensin, which in turn allows the blood vessels to stay open, which reduces the pressure. Calcium channel blockers work with preventing calcium from entering the muscle cells of the arteries and heart, which allows the vessels to relax and open up, reducing the heart rate and lowering the pressure. Beta blockers reduce the heart's workload and output of blood by reducing the heart rate, which lowers the pressure. So, common side effects can be weakness, tiredness, or drowsiness, erectile dysfunction, trouble sleeping, slow or fast heartbeat, skin rash, cough, muscle cramps, headache, dizziness, or lightheadedness, constipation, and feeling thirsty. You should understand that blood pressure medications do not always cause side effects. Some people may have some mild ones that can include the dizziness, stomach pains, headaches, or swelling in the legs or feet. But some diuretics may decrease your body's supply of the mineral potassium, which may result in leg cramps and tiredness. You can reduce the risk of losing potassium by eating foods that contain potassium, or your physician may order potassium tablets. Women taking ACE inhibitors or ARBs really need to talk to their physician before becoming pregnant, since these medications can be dangerous to the mother and infant due to low blood pressure, kidney failure, excess potassium in the blood, fetal malformation, or even death of the baby. So what are some reasons I should call my doctor, you're asking? Well, you should always call your doctor before taking any over-the-counter medications. You need to make sure you read the labels and look for warnings related to high blood pressure medications. Then call your physician to see if it's safe to take them with the medicine that you are prescribed. You also need to look at the active and inactive ingredients of all over-the-counter medications to determine if there is any sodium in the list. One dose of that over-the-counter medication could be higher than the recommended daily amount of 1,500 milligrams of sodium that is recommended for those with high blood pressure. Supplements do not always work in the way that they are labeled and may interfere with your medications, causing your blood pressure to rise. So no matter what medication you take, you always need to talk to your doctor to see if there's a risk of interaction with any of these herbal supplements that are over the counter. Decongestants can also interact with your medication and raise your blood pressure. Cold and flu medication that you can get over the counter may contain these decongestant medications in the ingredients. So it remains important to always read the label and speak with your physician about what is safe to take. The common trend with any medication or supplement that is not prescribed is to make sure to ask your physician and be aware of any potential drug interactions. So the other questions you may have: what if I do not have a local pharmacy? How do I get my prescription blood pressure medications then? Well, according to Healthy People 2030, social determinants of health, which are the conditions in the environments where people are born, live, work, play, worship, and learn, as well as their age, which can all have an impact on their health, well-being, and quality of life. When you take these factors into consideration, you realize there are communities throughout the United States that do not have access to local pharmacies to obtain their medications or have insurance to assist with paying for them. So what are their options? The first thing to do is to be honest with your physician. If you are unable to afford your medications, they may be able to supply you with samples to start with and give you information about different assistance programs that are available. There are multiple online pharmacies available that will send the medications to you. And all you have to do is enroll with them and then let your physician know where to send the prescription. Some pharmacies in your community will also offer prescription delivery, and others allow mail ordering. What other resources are available? Well, some pharmaceutical manufacturers may sponsor patient assistance programs that provide financial assistance to low-income individuals. Federal and state programs include Medicaid and Medicare, but some states also have their own pharmaceutical assistance programs, which are also known as, or patient assistance programs known as PAPs. There are some large chain pharmacies that will offer prescription savings programs for a fee. There are nonprofit pharmacies, and most online and mail order pharmacies are less expensive. There are also different coupons or discount cards you can use, and many times the pharmacy can compare these options to see which one will give you the cheaper price. Then finally, you can reach out to some nonprofit organizations to see are they willing to assist you with the cost of your medication if you meet the requirements. Remember, never substitute your prescription medication for an over-the-counter medication that is similar, and do not take someone else's medication, even if it is the same name. It could be a different dose or a different medication in that bottle that they're handing to you. In the comments section, there is a handout available for you that you can open, and it'll have links in there that can direct you to some of the online pharmacies and different assistance programs. So I want to thank you for your time today, and I hope you found this presentation informative and hope you find use of the handouts provided in the comments, the handout provided in the comments. I want to thank you very much for your time.